Hello, I'm Dr. Youngjin Park from South Korea, and today I'm going to talk about the infraorbital hollowness. Also, we can call it as tear-tooth hollowness treatment with HA filler and PDO threads combined. So to treat the tear-tooth hollowness, we first have to know what tear-tooth is. As you can see in the figure, before we treat tear-tooth hollowness, we have to know what the tear-tooth is and where it is. I want you to remember this figure to see that there are two different hollowness. You can see it. And we can commonly be confused with these two different hollowness. First is the tear-tooth hollowness, and second is the nasojugal groove. And there might be both of them, or there might be either one. So you have to know which one is which. And as the skin becomes ages, the skin becomes loosened, and as well as the retaining ligament that holds the skin becomes also loosened as well. And that's what it makes the tear-tooth hollowness and the nasojugal hollowness. So we have to tell our patients that it's better to interrupt when they're young, because it will be very hard to treat when we get older. And to treat the tear-tooth hollowness, we also have to know the anatomy, because it's not just, we can't just inject filler or insert the thread where the hollowness is, because there are many anatomical characteristics regarding the tear-tooth hollowness, and we need to know them well to treat the hollowness in the right way. This is a sagittal cut of where the hollowness is, and you can see the orbital fat and the tear-tooth ligament. And to see it a little bit directly, this is the middle side of the sagittal cut. You can see the tear-tooth ligament, and you can see the orbital fat, and you can also see the malar fat. And in the lateral side, you can also see that the tear-tooth ligament elongates to be the orbital retaining ligament. And you can also see that there's the zygomatical cutaneous ligament right down, which also makes the nasojugal groove. In this image that shows what happens when we age, you can see that the skin becomes loosened, and as well as the retaining ligament also. However, the ligament is more dense and more strong, so the length hasn't been changed that much compared to the skin. So what happens is that when the ligament retracts the part where the skin is connected, the hollowness becomes a lot more appeared. So when you compare to the image before I showed you with the anatomic image, you can see that if this is the orbital retaining ligament, then this will be the tear-tooth hollowness. And if this is the zygomatical cutaneous ligament, this can be the hollowness with the nasojugal groove. And these are all the retaining ligaments in the facial area. These are helpful not only just to treat the tear-tooth hollowness, but also to, when you're using the filler for volume regurgitation and also the thread lift, you have to know these strong ligaments, where to put it and where to help. And these are the main vessels that are placed near the tear-tooth area. But I just want you to scan them, not to remember all of them, because it is very important to know where it is, but we cannot dodge every vessels, because there are a lot of vessels, excluding these important ones, and there are also so many variations of these vessels. So we cannot dodge all the vessels, but you have to know that where it comes from, so we can be more careful about it. So now we know what there's, now we know about the anatomical characteristics of the tear-tooth, but before treating the patient, we have to evaluate the patient and how worse the type of the tear-tooth has. This figure will help you to decide where to treat and how much to treat and what materials you will be using. The figure A is the normal and is what we have to accomplish after the treatment. B is the skin fat depression. C is also the skin fat depression, but it's a different area. First one is the tear-tooth area, and the second one is the nasojugal groove area. And D is for the excessive muscles. For this one, it's very easy to treat because you only need botulinum toxin to release the muscle tone to make it better. E is the protrusion of fat, and F is the depression of skin and fat, also the malar bone. But however, in the field, when the patient comes, it cannot all be divided just be A, just B, just C, just D, because there might be B plus E, or there might be also B, C plus E. And also, even though it has the same type, if the patient has B, but they might have the different severity. So we can also put it as B1 to 5 for the severity. So if some patient comes, the patient might have B, also E, and the B might be B2, E might be E3. So we can evaluate the patient as B2, E3. Then we can choose the materials and how much cc of the fillers the patient might need. And we can standardize our treatment so that we can look a little bit more professional to the patient. So for the procedure, there are a lot of treatments for the tear tooth hollowness. The first choice might be the surgery. But however, you know that if you're going through the surgery, there will be a lot of downtime. Because if you go on a surgery, there will be about like 1 or 2 weeks time frame to heal, and there might be a bruising or there might be a lot of edema. But you know that the surgery can get the best result, but nowadays people want to recover really fast and go back to their life easily. So the second option they think about is filler. But as you know that if you use a lot of filler in the tear tooth area, there might be defect called Tyndall effect, because the HA can defect the sunlight and become a little bit bluish. And if there's too much filler inside, it might look a little bit puffy. So the third option is the laser. But for the laser, there are a lot of lasers such as HIFU, RF, or CO2, plasma, or you can use a lot of lasers, but you cannot get a direct effect with the lasers. So there are a different option called the polymers. As the Dr. No told us, there are some polymers called as PLA, PDLA, PDO, PCL. It can also help regenerate a lot of collagen and regenerate a little bit of volume, but it takes a little bit of time for that. And the fifth option is the thread. The thread that I'm using is called Gember, and it's very nice thread because it has a very good effect of a strong power to hold the skin, and it has the effect of the regenerating new collagen. So for the procedure, I'm going to tell you while watching the video. Before evaluation, I mark where the hollowness is, and I make my patient laugh a little bit, because when the patient laughs, they look a little bit younger, and so I can see where the volume is the most. And now I'm placing where I will be placing the thread. Actually, this patient is very young, and I use dental lidocaine with the lidocaine to decrease the pain and also to decrease the blood vessels that are near, to decrease the complication of the filler. I use both filler and thread because for the volume of the front cheek, the filler will be the best option, and also it'll be very safe because there aren't that many vessels that will be near where the filler goes. So for first, I'll be placing the filler. This is the 23 gauge needle. I'm going to punch a hole, and I'll be using 23 gauge cannula. For the front cheek, I usually use 300 or 500 epithetic because to make the volume, and also to support the retaining ligament so that it can go upwards. Normally, depending on the patient, I use about like 1 to 3 cc of filler for the front cheek. This patient was very young, and also she didn't have a lot of volume on the front cheek, so I used about a little bit more than 1 cc of filler. You can also use a needle, but the cannula worked a little bit better for me, and I think using cannula will be a little bit more safer. And I'll be skipping a little bit. Then the next side, and also after the filler, I'll be using the Gember thread. And I used the 18 gauge needle to make a hole, and this is 23 gauge Gember. I place it right under the orbital retaining ligament. After the video, I'll be showing why I use this Gember this way. And one more, a little bit upwards. You might think that I placed the Gember on the same level, but actually I placed the Gember on a different level. On this one is a different type thread. This is a mono thread with a cannula type. I use it to decrease the fat layer, and I'm going to tell you after the procedure. Normally, I use a very hard type filler in the front cheek area, and usually 23 gauge Gember for the hollowness. And also I use a little bit of mono thread for the protrusion of the fat. And after this, I'll show you the result. You can see that she didn't have a lot of volume here, and she got a little bit of volume, and also the hollowness has been gone a little bit away. The procedure I did was 3 type. The first one was the hard type filler. I used 23 gauge cannula, and you can also use a needle injection, but just the cannula was a little bit safe and a little bit more comfortable for me to use. And for the Gember, I used 21 or 23 gauge Gember for the hollowness. Some people might say that 27 gauge or 25 gauge Gember will be more safer, but I have a different way of thinking. And my way, I have to use 23 or 21 Gember for the infraorbital hollowness, because to make the strong holding power. And also, if the patient has a little bit more skin laxity, I use 27 or 30 gauge cannula for subdermal correction with filler or with the polymers, such as PDLA or PDO, or some filler with a very low G prime. This is the bridge technique that I'm saying to the patient, because using the Gember thread. As you can see the video, this will be the Gember. When I place the Gember, this bridge has the power to hold the skin in the top of it. And also after the Gember is inserted, the new collagen fibers will be made through the Gember. And this cement will be the collagen fibers that will be made by the Gember. And after about like 5 to 6 months, there will be network of the collagen fibers that will be holding the skin that was loosened. So not only that it has the holding power right away, after a few months, it'll have the effect of the new collagen fibers that will be helping the skin laxity, which will make the skin a little bit more stronger, so that it will hold the skin tighter, and also to block the protrusion of the fat. So we know that we can use the filler for the volume augmentation, but why do we have to use a thread, and why does it have to be Gember? The reason is that the reason I told you that by using 21 or 23 gauge Gember is that it has the strong holding power, so that it can be explained that the Gember as the wood that will be holding the skin as a roof. And also it can make a lot of new collagen fibers. This will be thread, and you can see that the inflammation will be happening throughout the thread, which will induce a lot of new collagen fibers. This experiment was done with the Gember thread, and these white holes will be the thread in a cut, because Gember is made in it's made as a spring type. So when you make a sagittal cut of the skin, you can see a lot of thread that are in the same layer. And you can see that there are a lot of collagen fibers that will be made after the thread insertion. And also, I told you that there will be a little bit of protrusion of fat after the skin ages. And also, PDO has the effect of very decreasing the fat layer. So when you insert the thread in the fat layer, you can see that the fat layer is this much. This is a subcutaneous fat. And after 120 days, the subcutaneous fat layer has been decreased. And these here, you can see that there's a thread, and this is a subcu fat, and the subcu fat will be decreased after 120 days. Because of these three reasons, I use Gember for the intraorbital hollowness, because nowadays people have a little bit of concern of using a lot of fillers. So I use a little bit of filler for augmentation, because filler has the best potential of the volume augmentation. And for the shallow part, I use a lot of Gember thread, 3 to probably 4 for max. And I usually use 23 gauge to 21 gauge on Gember for the infraorbital hollowness, because it has the strong holding power. Because if you use 27 gauge Gember, it can make collagen, but it doesn't have the power to hold the skin tighter. So the patient might feel that he or she doesn't have any direct effect after the procedure. So it's better to use 23 gauge Gember. And you don't have to worry about the Gember, because the spring that is made from the Gember is still there after the insertion. So it doesn't move or it doesn't dissolve. It just stays there. So it doesn't, there is a little bit of pain only for 1 or 2 days, and the pain will go away, not like the cold thread. And this is also the one image that's showing that the subcutaneous fat is very decreased after 120 days. To treat the infraorbital hollowness, I recommend doctors to see the face as the whole, not just one, because if you just treat the infraorbital hollowness itself, then it might not look very young, because the whole face is very old. And if the infraorbital hollowness is only young, it'll look very weird. And for the procedure, I recommend people to use combined procedure, because each material has its own strengths, such as filler has good potential of making volume, and thread has good potential of having good strong holding power and making new collagen and decreasing fat. So it's better to use combined procedure to make a better result. And lastly, you have to have enough time for consultation, because you have to see the patient and you have to know what the patient needs, because maybe the patient wants more, or maybe the patient wants a little bit less, or the patient wants to go home directly, or the patient might have a meeting after the procedure. So you have to have enough time for the consultation and see what the patient needs, and to evaluate how much the patient, such as the type that I told you before. And after that, the procedure, and if you had enough time for the consultation, the patient might feel a little bit better after the procedure. This will be finish of my lecture. And if you have any question, you can use my line ID. Thank you for listening.